Welcome once again. My name is India Nielsen-Barfus, and I am a program manager in the Office of Outdoor Recreation. Thank you for joining us for today's Summit Speaker Series. Before I introduce today's moderator, I do want to quickly mention an article that I learned about recently. It was written by the 14-year-old daughter of one of our office's frequent partners. It is an article called Into the Outdoors, and it is her teenage perspective on mental health in the outdoors. I got to preview this. It is a great read, and it's going to be published soon in Discover Utah Kids magazine, so keep an eye out for that. Again, it is called Into the Outdoors. With that, let's go ahead and jump into today's event with an introduction of our moderator, BreeAnn Silcox. She is the Suicide Prevention Coordinator at the Salt Lake County Health Department and also chairs Salt Lake County Suicide Prevention Coalition. After graduating from Utah State University in health education, BreeAnn Silcox started her career in public health with the Bear River Health Department, where she worked for more than 6 years. And in 2019, she came to Salt Lake County to serve as the Suicide Prevention Coordinator for the Salt Lake County Health Department, as well as chair of the Salt Lake County Suicide Prevention Coalition. While she's worked in various public health programs throughout her career, she's most passionate about mental health and suicide prevention. So BreeAnn, thank you so much for being here and lending your expertise to this conversation. The time is yours to introduce our speakers and lead today's discussion. Thank you.
Awesome, thank you. I'm excited to be here as well. So I'm, like India said, I'm going to go ahead and I'll introduce our panelists for today. So just to start, our first panelist is Christy Jones. She was born and raised in Ogden, Utah, and she spent 10 years working in Boise before returning to Utah. She earned her undergraduate degree in public health from Utah State University and a master's of public health from Idaho State University. She currently serves as a senior consultant for mental well-being for Intermountain Healthcare. And prior to coming to Intermountain Healthcare, Kristy worked at Weber State University and the Idaho Department of Health and Welfare. So welcome, Kristy. Our next panelist is Melissa Joy Hansen. She is the co-founder and executive director for Continue Mission, which is a nonprofit organization serving veterans with physical, mental, and emotional injuries. She ended her career as a chemical engineer to take on the challenge of helping her husband, Josh, through his healing process when he returned home from Iraq with injuries in 2007. Together, they founded Continue Mission in 2014. Melissa represents Continue Mission for the Utah Suicide Prevention Coalition, Davis Helps Coalition, Local Coordinated Council UTA meetings, and Woods Cross City Community of Promise. Melissa is a member of the Daughters of the American Revolution, and she volunteers her time playing her saxophone with the Golden Years Jazz Band. Melissa and Josh have been married since 1994 and have 3 beautiful children and 2 grandsons. So welcome, Melissa. And then our third panelist will be Josh Allred. He is the creator and chief architect of Pivot Adventure. Josh started his workshop to make a dent in the industry that has gotten out of hand. He graduated from Utah Valley University with a degree in outdoor recreation management. With over 15 years of experience working with youth, Josh defines his career by the impact he's had in teaching others. His other big project to date is his blog with over 1,700 consecutive posts about breaking false limits and leveling up. So welcome, Josh, as well. So Kristy, we're going to go ahead and start with you. Can you talk to us a bit about how the outdoors and physical activity can improve mental health and how that complements traditional medicine?
Thank you so much, BreeAnn, for the warm introduction. I'm really happy to be with you all today. And you should be able to see my screen. Can you confirm if you're, yes, I see a thumbs up. Thank you. So I want to go in and talk a little bit about what Intermountain Healthcare is doing before we dive into that question to address health in our community. The health of our community has been such a high priority for us these last 5 to 10 years, and it is awesome to be able to have a really strong focus on the areas that I'm showing in this slide. We did a needs assessment and determined that air quality is an issue, and we all know that sometimes, especially during an inversion, Utah air quality can be really poor. So we're working to actively address air quality, to improve immunization rates in the state, prevent unintentional injuries, prevent conditions that are related to unhealthy weight. And then the 3 areas where I'm most actively involved in is suicide prevention, substance use disorder or substance use prevention, and then improving mental well-being within the communities that we serve. And that's why I'm here today, is to really be able to talk about it. And I want to acknowledge that COVID-19 has had a profound effect on the mental health of many of us. Even just this last January in 21, 43% of Utah adults reported that they had increased levels of anxiety and depression. And nationally, 51% of people are reporting a worsening in their mental health since the beginning of COVID-19. And we recognize that from past disasters, including wars, terror attacks, natural disasters, disease outbreaks, they can be short, or there will be short and long-term mental effects. And so we can recognize that moving forward, there will be issues we need to address. And Intermountain has been working really hard to frame the crisis in a good way and really ramp up the availability of telehealth services or telebehavioral health services and things like that, to really make sure that people in our state continue to have access to the behavioral health care that they need. So I didn't want to dive in without really acknowledging COVID-19. So let's move on and really talk about the fun stuff and about how spending time in nature is going to make a difference and really help us feel better. And so when we look at the amount of time we're spending in nature, there's actually been studies that have shown that there's a real happy medium, and it's like 120 to 300 minutes. So if you can get at least 120 minutes a week in nature, that will be associated with improving your health and your mental well-being. And as we looked at research, over 300 minutes didn't improve your mental well-being any more than that 120 to 300 minutes. But we recognize that spending that time out in nature is what really makes the difference. And it does not matter what the quantity per day, what the quality is. It's just getting out there in the green environment, really enjoying your time outside. You will find lower probabilities of cardiovascular disease, diabetes, asthma, hospitalizations, mental distress, mortality, and on and on. So with that, we really want to encourage people to take the time and make plans to be out in nature as much as possible. And we also found that it doesn't matter what age group you're in. It's the same consistent for young people, middle-aged, older adults, you name it. If they have a long-term health issue or if they're not ill at all, the time in nature will make a difference in your overall health and mental well-being. Okay, so when you're out in nature, what are you going to be doing? And I am curious, and I'd love to encourage people to put some answers in the chat. What are your favorite hikes? What are your favorite things to do when you're out in the outdoors, and those favorite outdoor activities? And researchers at the University of Utah have found that, again, it's not just the time outdoors, but there's significant mental health benefits to spending time doing activity outdoors. And so spending that time outdoors, especially doing the activities, will also improve the mental health and lead to stronger mental health outcomes. And you're going to hear soon from Melissa Hansen with Continue Mission. She and Josh are some of my favorite people ever, and I'm so pleased that they're here. They do this. They work with veterans. I'm not going to steal your thunder, Melissa, but they're out there helping the veterans be in the outdoors and be active and be engaged with each other. And they do amazing work. And I'm so excited for them to speak with you. Now, it's togetherness and bonding as well. Being able to spend time with each other and do activities together, that improves that social connectedness. So any kind of activity, hiking, running, walking, camping, picnics, biking, although I am afraid of the downhill mountain biking, but mountain biking, I'm just too afraid of falling. So you guys, I'm not the best mountain biker ever. But we know that those positive benefits are there. We see reductions in stress. We see reductions in anxiety. And you're going to see psychological healing, an increased sense of mental well-being. You'll feel restored. And it's just awesome. All right, so let's talk about kids. And what does being outdoors do for young people and the benefits we're going to see for these young people? And don't we all wish we were on this beach with this family right now? But there are 3 different levels of benefits. And the first one is physical. So when children spend time in the out of doors, they're going to have improved motor skills. They'll have a lower body mass index, or BMI. Their risk of asthma, obesity, type 2 diabetes, other related health issues, not only will they be lower during childhood, that effect will expand into their adulthood. And the habits of being outdoors and being active outdoors will spread into the outdoors. And just like adults, we will see improved overall health benefits, like the mood, the immune system strengthening, things like that. Now, intellectually, we've got intellectual development benefits for kids. Being out of doors, playing, doing activities, spending time in nature, it increases creativity, it aids with brain development, strengthens communication skills, and it expands their scope of learning. And then our third area, and this is one that is challenging for my nephew, and I'm going to talk about him in a little bit, is the social development benefits. And when kids can be out of doors and play with each other, it increases their ability to interact with other children, other individuals. It increases their openness with their parents or caregivers. It improves their self-awareness. It improves their appreciation for the environment, and really helps strengthen that sense of independence. And so huge benefits for children, young people spending time in the out of doors. Now, I won't spend a ton of time on this, but the green space in urban areas is so important. And I really wanted to point that out for anyone who feels like they live in a really urban area. In more urban areas, the more green space you have, the higher health benefits you have from that access to the green space. It has a really strong beneficial effect, and the less green space, the worse. And so we really want to make sure that people who live in an urban area, they not only have green space available, they access it. A friend of mine told me she has 10 parks in her neighborhood, and she and her kids rotate which parks they go to each time they go out. And not only do you have the mental health effects or benefits of spending time outdoors when you're in an urban area, but you have that physical benefit, because you can take classes together, you can do physical activity, and it really helps lessen that burden of social isolation and connect with a greater community, and just really have those improvements. And just like in my earlier slide about the impact in an urban area, you have the same impact of using the green space and time. Reductions in mortality, reductions in obesity, improvement in your physical well-being, improvement in your perceived general health, etc. And the neighborhood that you're in matters. If you do not have access to green space, you literally have lower health outcomes. And we see a lot of racial and ethnic disparities with green space and the access to green space. And so that is really important. And if you're in a neighborhood with a lack of green space, we encourage people to make the effort to get out and find the green space you can. And even in Utah, we've found that the zip code that you live in matters. And for your health, even more than your genetics matter. These are actual communities in Salt Lake County, 2 different made-up zip codes, but it's data from Salt Lake that showed for people with access to higher green space that they had higher graduation rates, less poverty, higher average household incomes, and higher life expectancies from 85 in the area with more green space to 75.8 years in areas with less green space, which is pretty shocking to see that disparity. Now, I'm going to be personal right here and tell you a little story. I wanted to share this picture with you. This is my nephew Noah, and he is absolutely amazing. He is brilliant, he's funny, he loves all things cars, but I told you earlier he struggles with the social component. He has Asperger's, and with the Asperger's, it's challenging for him because he doesn't like to try new things. He doesn't like to meet new people. He won't say hello to you, but if you start talking cars to him, you'll never be able to shut him up. So a few years ago, we took him hiking in St. George, and he totally melted down. The sun was touching him, and he was hot. This was Easter weekend. It was not hot. People said hello to him as they passed him on the trail. We had 3 meltdowns before we made it to the river on this hike. And he begged to go back to the car, but my sister's really good with him, and she was able to help him keep going. And you can kind of see in this picture, they're sitting above a pond in here. And I see, you can see the little glint in his eye of trouble. He's got something planned here. And sure enough, he, sorry, I set a timer and it's going off that I'm almost out of time. He's up to no good. And as soon as my sister put her phone down from taking this picture of him, he dumped her into the pond and literally like pushed her into the pond. And you see that look of joy on his face and that smile and just how happy. He was so happy that he pushed his mom into the pond and she got soaking wet. And that positivity in him lasted for the entire Easter weekend. It wasn't just while we were on the hike. It was up to the second waterfall, up to the second pond where they could slide in together. And it was the entire hike back to the car and then the rest of the weekend. So I use him because he is such a good example of how even just your mood can change when you have that positive interaction in nature. And with that, I want to thank you, India and BreeAnn, for the time to present and be here today. And I will stop presenting now and turn it back over to you, BreeAnn.
Awesome. Thank you, Kristy. I really appreciate the information that you shared with us. And thank you to all those who asked questions in the chat box and made comments. Again, we'll address those questions at the end. So we're now going to shift a little bit to Melissa. So Melissa, would you explain how Continue Mission got started, what services are provided by the organization, and what the impact has been on veterans?
All right, I would love to talk to you about Continue Mission. Thanks for having me today, and it's great to see so many familiar faces. I could take Kristy's presentation and just insert it throughout mine. It was perfect. So I thank you for leading, Kristy. So Continue Mission, we are a nonprofit organization. We serve veterans with physical, mental, and emotional injuries and their family and support members. We provide recreational and educational events that support and empower them, offer them opportunities for healing and camaraderie, and result in improved mental health. So before I talk any more about Continue Mission, I think it's important to understand the background about why we started Continue Mission. So I'm going to introduce you to my husband and Continue Mission's co-founder, Sergeant Josh Hansen. So after the events of 9/11, Josh was so affected by that he joined the Army at 30 years old. And when Josh served in Iraq, he served as an IED hunter. So his job was to search the roads of Fallujah and Ramadi for improvised explosive devices. And unfortunately for Josh, over a 6-month time period, he was directly hit by 8 of those devices. So Josh came home from Iraq in 2007 and spent several months in the hospital and then several years at home recovering from traumatic brain injury, post-traumatic stress, depression, anxiety, neck and back pain. Josh started to go down that road of thinking about ending his life. He didn't feel like he had a purpose anymore. He couldn't process information. He couldn't function. He was isolating and depressed. And sadly, one of his good friends and fellow soldiers died by suicide. And for Josh, that was a huge turning point in his life. He decided that's not what he wanted, and he decided it was time to turn his life around and find a new life for himself, a new purpose. Before the Army, he was a business owner. He worked 12 hours a day, 7 days a week. So he knew that it was time for him to start to find something again. So he began a many years long recovery process, and that process started with professional help and then continued with physical exercise. He started with 1 mile a day and then just increased the exercises he did. He started mountain biking. He learned how to ski at 40 years old. Trail racing, paddleboarding. He spent time in the outdoors and nature. He did a lot of activities together with our family. He enjoyed camaraderie with fellow veterans. He started eating healthy. And all of these things really helped him in his recovery process. And as he started to find joy in life again, we decided that we wanted to help other veterans and other family members find this same path to healing that we had found together. And so we founded Continue Mission in 2014. So our goal with Continue Mission was to use those methods that had helped Josh with his healing process to positively impact the mental health of our veterans and their family members, to decrease veteran suicide, and to improve the relationships of our veterans, not just with their family members, but also with civilians. We have accomplished this goal through providing recreational and educational events to our veterans and their support members at no cost to them. So I'm going to show you what some of our events include. And I love what Kristy said about 100 minutes a week in nature. That's all you need. So if there's any veterans out there, you just only have to come to one of our events a week and you will have your 120 minutes. So we do bowling, cycling, disc golf. This was our family night with the birds at the Tracy Aviary. We do nature walks. We do paddleboarding, pickleball. This was an adventure at the pumpkin patch. Rock climbing. While I'm on the rock climbing slide, a shout out to Josh Allred, who will be presenting next. We've done rock climbing with his group and we love going out with them. This was our Royal Creek Ranch family adventure. We do alpine ski and ride. We do cross-country skiing, snowshoeing, softball, trail walks, volleyball. It's kind of hard to tell. I went really fast through the pictures and they're small, but the common theme among these pictures is the big smiles on the faces of our veterans. And one of my favorite stories is we had been out on an event with one of our veterans. He was a new veteran to our program, and his wife and kids came to pick him up after the event. And his kids got out of the car and they said, "Look, Mom, Dad is smiling." And I will never forget how that felt to see those kids be so happy that their dad was smiling. So in 2020, we were able to hold 119 COVID-friendly events. we served 1,724 participants. Back in 2019, before COVID, we held 169 events and served 3,535 participants. We're hoping as the world slowly opens back up again to get our numbers back up and get more veterans out of the house, out of isolation, and moving again. So you're probably wondering, why do these events have a positive impact on the mental health of our veterans? So first of all, I'm going to show you this chart. So we hold an annual survey for our veterans, and the survey is so that we can gauge the impact that our events are having on our veterans. And so a lot of the charts I'm going to show you are from that survey. So as you can see from this chart, over 70% of our veterans experience anxiety and depressed mood. A lot of them, over 50%, have difficulty enjoying activities. They have pain, they have nightmares. And so moving on to the next slide, the Journal of Clinical Psychiatry, this is a quote from them saying, "Exercise improves mental health by reducing anxiety, depression, and negative mood, and by improving self-esteem and cognitive function." This quote's from Whole Brain Health. "Exercise modulates the secretion of major neurotransmitters dopamine and serotonin, which are linked with treating depression." And another quote from the Mayo Clinic, "Regular exercise may help ease depression and anxiety by taking your mind off worries so you can get away from the cycle of negative thoughts that feed depression and anxiety." I love that quote, because if you think back to some of those pictures I showed you, if we're out cycling with our veterans are worried about the path in front of them and the nature around them. They're not thinking about the traumas they've experienced. They're thinking about that event. They're in that moment. If we're out playing pickleball, they're thinking about returning the ball across the net rather than some of the worries that bother them. So this chart shows some of the challenges our veterans are diagnosed with. So post-traumatic stress, about 70% of our veterans have post-traumatic stress. Over 40% or about 40% have traumatic brain injuries. So my next quote talks about that. This quote was put out in 2019. "Exercise can alleviate many of the symptoms of depression, such as fatigue, tension, anger, and reduced vigor. For people with panic disorder, post-traumatic stress, and other anxiety-related conditions, exercise can be a proactive way to release pent-up tension and reduce feelings of fear and worry." So I'm just going to do one more quote at you all. I really love this one because Continue Mission loves to focus on camaraderie. Camaraderie is so important, and it's not just about the veterans, it's getting the veterans' families together, their spouses. We are able to talk to each other, share experiences about what our veterans are going through and the different ways that we're able to help them with their healing process. So the quote from the Mental Health Foundation: "When someone has a mental health problem or is experiencing mental distress, it is important to try to keep friendships going, even though people with mental health problems often want to see their friends less than usual." And I'm going to skip to the bottom one. "Friendships work both ways. A mental health problem doesn't mean that you're never able to support or laugh with someone else." So this really plays a part at Continue Mission. We have veterans that when they're feeling depressed, they want to come out to an activity because helping somebody else with their day and making somebody else happy helps them with their depression and their mental health. One of my favorite things is we had a Vietnam veteran and we had a post 9/11 veteran, 30-year age difference in these two veterans, and they met at a Continue Mission event, and they started doing First they started coming to Continue Mission events together, and then they started going fishing together, going for long rides together. So we love having veterans come to events and meet each other and become friends like that. And then they start doing physical activities outside of Continue Mission, and that's wonderful. We love that. So now I'm going to get into the actual impact our events has had on our veterans, and these results are taken from the survey that I talked about that we give our events each year. So you can see from this chart that over 80% of our veterans report that participation in Continue Mission events has had an improved impact on their mental health. Sadly, over 40% of our veterans reported that they had had suicidal thoughts in the year leading up to this survey. But the good news is those veterans also reported, over 80% of them reported that coming to Continue Mission events resulted in a decrease in their suicidal thoughts. This slide, over 80% of our veterans reported that having their family or support members come to Continue Mission events with them had an improved impact on their relationship with those support members. And along those lines, over 60% reported an improved impact on their relationship with civilians when we were at events where civilians were also invited. So I'd like to finish up today with just a couple of Continue Mission facts. 94% of our donations go straight to our Veterans Recreation Program, so we only have 6% that goes to overhead. We serve all era male and female veterans. So we have veterans from their early 20s up to, we have a Korean veteran that comes out with us all the time. He's 89 years old, and seeing him play volleyball and pickleball is awesome. We love having him come out. Many of our events include our veterans' family or support members. We hold events throughout the year on weekdays and weekends. Our events are at no cost to our participants, and we have a 15-passenger bus, so we're able to provide transportation to many of our events. So that's what I have to say about Continue Mission. Thank you so much for letting me come today and talk to you about Continue Mission. Take care.
Awesome, Melissa, thank you so much. It's such an awesome thing that you and Josh are doing with Continue Mission. So thank you for sharing all about that. And then just so we are aware, Kristy has been kind of answering questions in the chat. So if you did type in a question earlier, she has been answering some of those, and we'll again address those towards the end. Now we're going to shift to Josh Allred. So Josh, we know that Pivot Adventure serves a variety of ages, but today we want to talk about the work that you're doing specifically with youth, and then youth who are facing mental health challenges. So what prompted the start of Pivot Adventure, and what makes the work successful that parents, teachers, peers, or others could do? You're still muted. Thanks.
Thank you for having me. I want to start real quick with a little sidebar. 1 year ago today was the earthquake out in Magna, and I was reading in the paper this morning, one of the groups that tries to educate those around here about earthquakes, it said, no one is coming to save you. And I took that to heart a bit. I think today's talk will hopefully relate to that, how we could become more resilient, and also why we should develop a different posture about saving others. So that's why I hope we'll touch a little bit on that today. So start out with a quick story. It's a two-part question. I'll start with why we started, and then we'll circle back around what for the successful part. So just south of the Greek island Samos is the Icarian Sea. And legend has it that's where Icarus died. A victim of his own hubris. His father, Daedalus, was a master craftsman, and he was banished for sabotaging the work of King Minos, captor of the Minotaur. And he comes up with a brilliant escape plot. And him and his son fashion these wings, and they fix them with wax. And right before takeoff, Daedalus turns to his son Icarus and says, "Don't fly too close to the sun." Well, Icarus, enamored by this magical ability to fly, he ignores his father and flies too high. The wax melts off, his wings fall off, and the beloved son falls to his death. The lesson from that myth is don't disobey the king. Don't disobey your father. Don't believe you are better than you are. And probably most importantly, don't believe you have this ability to do what a god might do. But there's also a second part to that myth that we don't talk about. And that is Daedalus turned to his son Icarus and said, "Don't fly too low, because the salt from the sea will weigh you down and you won't be able to get the lift you need, and you would surely perish." And I think society has really altered this myth. And we've created this culture where we forget about that second part about the sea. And we've also created a culture where it feels really dangerous to stand up and stand out and to make a ruckus. And we also created this culture where it feels like the cardinal sin is hubris. But in fact, what we more often fall into is settling for less. And so what I hope that people can grab from this story is that understanding that it's far more dangerous to fly too low than it is to fly too high, even though it feels safer to fly low. And so when we settle for these low expectations of ourselves and small dreams, the guarantee is we're gonna do less than what we are capable of doing. So the path ahead for us isn't just recklessness and mindless compliance. The path ahead for each of us is to do art and to be human and to fly higher than what we've been taught and what has been expected of us. We've built this world where it's never been possible to fly higher, and yet the great tragedy is that we end up settling and flying ever lower instead. So Pivot Adventure is an adventure-based mentorship course for teens. We focus on resiliency training and helping our students, particularly 12 to 17-year-olds who are struggling with depression, anxiety, isolation, and suicide ideation even, step out of their comfort zones of flying too low and step into the growing zone of flying a little bit higher. And we do that by challenging our narratives. We do that through storytelling, like the Icarus story. But we also do it through understanding where fear comes from. And so right at the back of our skull are two almond-shaped nuclei, the amygdala. And the amygdala has kept us alive for thousands of years. It's why when someone yells "4," we duck our heads. And when someone cuts us off in the freeway, we swerve out of the way. But it also sabotages us from doing our best work. So when we get a text Friday night from the boss saying, "Hey, there's something wrong with these TPS reports. Let's talk about it first thing on Monday." But, oh my goodness, they found out about that one thing, and I'm going to get written up, and then I'm going to get fired, and then I'm not going to be able to pay the mortgage, and so I'm going to be out on the street, and then I'm going to die, right? So for teens, it looks like I posted a picture, and I got 50 likes on it, and then I posted another picture the next day, and I only got 20 likes. So what's wrong with me? And so really understanding that that fear is not going to go away. Our brains have not developed as fast as our culture has, especially in the last 200 years. Our brain still thinks there's saber-toothed tigers that are going to come out at us from the bushes when we hear a stick break, and doesn't understand that saber-toothed tigers don't exist anymore. And so we can't push that fear away. And so what we teach our students is to learn to dance with that fear. And that's really at the heart of what we teach and why we started Pivot Adventure. The landscape is pretty daunting. The #1 cause of death for teens, for particularly here in Utah, is suicide. So we're really trying to stem the tide here. We've had 90 students go through our resiliency training program. The program is 8 weeks long, so there's quite an investment. We do the 4 hours at a time. So like Kristy was talking about, that 2 hours of outdoor time per week, we do that. And the results have been stunning when we've gotten surveys back, which is why we continue to do it, that students are happier, they're more connected, they're more optimistic, they have a better ability to persevere, and they're just more engaged. And so that's why we started our program and why we continue to do it to this day. So the answer to the second part is of your question is what makes the work successful for others that they can take away from here. I was thinking about this, and the quote from Alice in Wonderland came to my mind. If you remember the little bit between the Cheshire Cat and Alice, it goes like this: "Would you tell me, please, which way I ought to go from here?" And then the cat says, "That depends a great deal on where you want to get to. I don't care where, so long as I get somewhere." The cat says, "Well, you're sure to do that if only you walk long enough." And the takeaway I've had from that story is there's no map. There's no step-by-step set of instructions to live a life of joy and meaning and happiness. What we need is to develop a compass. And that's what we do at Pivot Ventures. We help our students develop this internal compass. And the way we look at that is if they're developing a posture that people like us can do hard things like this. The late Clay Christensen passed away last year, posed the question, how will you measure your life? And too often we use things like grades and titles and accolades and status and money, Facebook likes. And we use those things because they're easy to measure. It's much more difficult to measure, did I open the door for somebody who turned around and opened doors for others? And did I help someone challenge their narrative and how they see the world? And did I help them level up? And so that's really how we're trying to measure success over at Pivot Adventure. The way I define success just in my own life and what we try to teach with our staff and our students, if someone learned something from me and turned around and taught somebody else, that's a really good day. That's a really good day. So just on my final notes here before my time's up, I'm really glad that people like Bob Dylan didn't stop making records after his first disaster album, right? And I'm glad that Jonas Salk, who developed the Salk vaccine for polio, gave it away for free. It's a vaccine that's worth $7 billion, right? And he just generously gave it away. And I'm glad people like Johannes Gutenberg, when he launched the printing press, 93% of Europe was illiterate at the time. And understanding that these people knew how to fly a little bit higher, right? That you understand that the greatest hits album doesn't come in the first go, but it comes after a large body of work. And that's something we can teach our students, that fail again, fail better, right? Towards this idea of progress. And, Salk was famous for saying, could you patent the sun? And that's leading with this idea, posture of generosity. I think we need more of that in our culture, that there are people that can be saved. And so are we going to just sit there and let someone else do it? Or are we going to stand up and be seen and be heard and make noise? And then lastly, understanding too that, 93% of Europe is illiterate. That's a terrible time to get into the book packaging business. But we know that we'll never be ready. So we should just step into this on stage and perform anyway. And when we show up and stand in there and say, this is me, I think we're not only going to help those along the way, but we're also going to be able to find the joy and meaningness that we are seeking in our lives. Thank you.
Awesome, Josh. Thank you so much. Sounds like you guys are doing some really great things at Pivot Adventure. So we'll go ahead and kind of open up our Q&A. Feel free to ask some questions in the chat. I'm going to just jump back to kind of the beginning. I know, like I mentioned before, Kristy kind of started answering questions in the chat, but we'll just kind of go through those. So the first question was about, it says, how are the COVID era suicide stats looking? Do you think people will be more inclined to be health and fitness focused because of what we've been through this past year? So as Kristy mentioned in the chat, our suicide stats have stayed the same, been pretty consistent throughout COVID. And she put a link in there if you want to look at that report a little more closely. But if Josh or Melissa, you have anything else to add on Kristy as well, I'll just kind of go through these because I know she gave answers, but if you want to add anything, please do while I'm finding this next question. Okay, the next question was, is there a chemical imbalance related to inversion causing these issues? Certain wavelengths of light or breathing in certain chemicals to create imbalances in the brain. So Kristy answered that. Let me scroll back down, sorry. She said, no documentation I'm aware of related to inversion-related chemical imbalance. There's a relation for people with seasonal affective disorder and lack of access to sunlight. So again, if anyone wants to add anything to any of these, please feel free. And next question was, I'm curious if those benefits you listed being outdoors is related to movement outdoors, such as specific activities, or just being outside in general, even if it's just sitting outside. And Kristy later in the chat mentioned that those benefits are from being outside. We see added benefits when we engage in activity as well, but really just getting outside is one of the keys there. And then another person asked, has anyone researched how the lack of public transit connections to nature in Utah has disparate effects on the health of Utah's minority populations? I don't know, Kristy, did you throw an answer in there about that?
I did. I suspect UDOT or UTA may have, but I haven't researched that. And so that's definitely something worth looking into, especially as we look at improving the equity in our state and doing a better job of serving our underserved.
Awesome. Thank you. Okay, then somebody else asked, do these statistics about access to green spaces account for confounding variables? For example, whether the link found is because both access to green space and the outcomes being measured are correlated with things like income, access to other resources, etc.
And you know, BreeAnn, I did answer that, but the studies, most of the studies do account for the variables. But if you're familiar at all with the redlining of neighborhoods that happened historically, many historically African-American or other minority group neighborhoods were redlined, and redlined neighborhoods tend to have more cement, more pavement, fewer trees, fewer parks. And then their residents actually, there was an article in the New York Times that the temperature in redline neighborhoods is as much as 10 degrees higher than in non-redline neighborhoods in the same city. And so where you live does make such an impact. And if we have individuals that are lower income living in a redline neighborhood, you have less ability to get a home loan, to see higher quality homes, to see the green space. And without that access, it just continues pushing that neighborhood and the people that live in that neighborhood into more and more health and other social related problems.
Awesome, thank you. The next question I think could go to any of you, anyone who wants to respond. It says, school age kids are having a hard time this school year. What sort of advice/activities can be suggested for those middle school, high school age kids that will make them like it? Is it worth it to force them to go until they finally have fun because they're outside?
I kind of, was that directed to me?
It's to anyone who wants to. Please go ahead.
I got distracted. I actually had something to add to Kristy's comment. If that we could go back real quick.
Sure.
So during the 90s, Chicago had one of the worst heat waves in U.S. history, and unfortunately, a bunch of people died from that. One of the things that they went back and studied on that there were some neighborhoods that had the same socioeconomic status as other neighborhoods, but they couldn't figure out why neighborhood A had more deaths than neighborhood B. Well, it turned out that neighborhood B, the only difference between the two was neighborhood B had a library. And so that population that passed away were generally older, elderly, and whatnot. And the librarians would go and check in on those people. And so it's just this idea of having community and access to the outdoors that Kristy is talking about. It's just as simple as a library, or the metaphorical library here in Utah with just, access to big cottonwood and little cottonwood. And you can see those benefits. And it's not rocket science, but it's just access. So anyway.
Awesome, thank you. Did you have anything to comment kind of on that second question about kind of getting our youth to maybe give it a little bit more of a try if they initially aren't loving the outdoors?
Yeah, that's a great question. Everything we build is around that, where we don't feel good enough, right? And it doesn't matter what realm we're in, there's going to be something that we don't feel good enough. Even I cannot feel good enough in this sphere, and this is with my colleagues and peers and those who are interested. But we all feel inadequate in areas of our life. And understanding that we want to step out of our comfort zones and into the growing zone, we're going to have to dance with that fear that we talked about. I'm nervous about what my peers are going to think of me if I get on these cross-country skis and I fall flat on my face. And so we are working with our students and constantly nudging them to tell a different story about themselves and how they see the world. And so we have an expression, I used it earlier, is fail, fail again, fail better. And we're always constantly failing at what it is we're doing. If we're always succeeding, then we're not trying hard enough anyway. And so I used also the analogy with Bob Dylan earlier. His first record is terrible. I don't know if anybody's listened to it in a long time. It's terrible. But then number 2 comes around and you're just like, wow, this is game changer. And, he continues a large body of work. He actually put out, I think he's got like 35 albums. He's got 3 albums where he does like gospel singing in them. They're terrible unless you're into that thing. And so understanding that we have to push our boundaries and our limits to find the edge. And understanding too that, it's much more difficult to jump off the high dive the first time when we're going over to the edge and looking down on it. It's much easier if we make the decision at the ground in safety. So if you make the decision on the ground once, then you don't have to make the decision. You've already made it on the ground. And so going to try things like rock climbing, where a lot of our students, are, on their phones and they play a lot of video games. They don't have a lot of friends. They're way out of their boundaries. And so we have to, 1, calm the amygdala, and then 2, tell a better story.
Awesome, thank you. Another question.
Yeah. No, if you have a different question, that's okay. I was just kind of gonna jump on his, but I don't want to take time from the other. I was just gonna say, I don't know how much it applies to youth, but it could if there's organizations with multiple youth. But at Continue Mission, we break our veterans out into groups because they're the same as kids. They don't want to fall on their face in front of their peers, the other veterans. So we break them out into groups. Some groups, if we do a bike ride, some veterans do a mile and some do 30. So we just try to break them out into groups. And one of our veterans is on here. I'm going to pick on her a little bit. I won't name you though. But the first time she came cycling with us, it's not something she had ever done before. I think she made it a couple miles. And now this veteran goes out cycling by herself weekly, and she's doing 20, 30-mile bike rides. And so if we can just get our kids out, get them trying it, then they could be. So I can name her now because she put a comment, but Julie, she's amazing. She's tried all kinds of new things this year. And so we just got to get our kids out there trying things, and hopefully they'll get more comfortable and progress. Thank you, Julie.
Thanks, Melissa. So I'll just ask this one last question. We've got about 1 minute left. It says there are higher rates of suicide attempts and ideation with LGBTQ plus youth and adults in Utah. I'm curious if any of the panelists are doing work specifically with this population. So I can actually answer this question too. Kristy, do you want to pipe in?
Well, I was just going to say there are amazing comments in the chat. And from the Intermountain healthcare side, we've been partnering with the Utah Pride Center to make sure that we're supporting their efforts, and also improving access to behavioral healthcare services for anyone who's LGBTQIA+, and that they have access no matter their ability to pay, because that's important for us. But as far as like engagement, I loved the comments in the chat.
Awesome, thanks. And I do know the State Utah Suicide Prevention Coalition, they have a whole work group that works towards LGBTQ plus efforts. So a lot of work being done in the state towards that. So that kind of wraps up our time for questions. I'm going to turn it back over to India to kind of close us out.
Thank you. Thank you so much, BreeAnn, and all of our wonderful panelists, and seriously awesome questions and conversations in the chat. I'm always happy to see some connections being made in there for people to follow up on different projects that are happening. As promised, I'm going to draw the name of somebody who asked a question, and we will be sending you a prize. Will this person please stay on just a moment later? Etha Williams, you are our prize winner. If you don't mind staying on for just a moment, I'll get your email address and follow up with you. Thank you so much. And again, Melissa, BreeAnn, Josh, Kristy, thank you all so much for not just being on today, but for the work you're doing. And I look forward to following up with additional information for all of those who attended today. Thank you so much.
Thank you.
Thank you.